It is National Black Maternal Health Week, and according to the California Department of Public Health, Black birthing mothers are 3 to 4 times more likely to die from pregnancy complications than any other group here in California.
Dr. Tanya Hines is an OBGYN physician with Kaiser Permanente Baldwin Hills, Crenshaw, and she's here to raise awareness of this important issue. Thank you so much for being here.
Thank you so much for having me.
I think when you hear that number, 3 to 4 times more likely, what is going on and how can we make changes here?
I think the most important thing is to understand that our African American mothers are more vulnerable because of some of the preconceptual issues that we have to address. So there's more hypertension, diabetes, obesity, and these are issues that perhaps have not been adequately addressed before pregnancy. And then within the entire population, it's an issue. So what do? Baby aspirin in that first trimester, starting for patients to reduce the risk of elevated blood pressure like preeclampsia.
Okay.
We talk about good nutrition in the pregnancy, so making sure we're not gaining too much weight. And then more importantly, doing everything we can to keep blood sugars, blood pressures under control.
Dr. Hines, what are some of the challenges that Black women face when we're talking about access to prenatal as well as postpartum care?
I think the most important thing is the resources and access with regard to what patients want to have, right? So they want to be able to have someone who listens to them and understands to provide them with those resources, like all of the things that we talked about. They want to be heard, and that means that there's inherently bias in the system. So we need midwives and nurse practitioners and labor coaches like doulas to really listen and create the village inside of healthcare. And then postpartum, we call that the 4th trimester. So that's 3 months after. What about our mental health and wellness? The hormones are raging. And so we're doing everything we can to support them with this new baby, but also depression is significant in those first 2 weeks is baby blues, and by 4 weeks is postpartum depression. Many patients don't want to feel like they're not doing the right thing, not being the best mother, and also not wanting to be on medication. So ultimately, it's the support that starts inside of probably the 3rd trimester so that we can make sure that they have the things that they need.
Are there any maternal warning signs that you tell people about to say, get in, see your doctor?
Absolutely. So what I notice is if someone has a headache, that maybe they have a history of headaches, but if they have a headache that's persistent, that they're starting to have swelling of their hands and feet, if they've got right kind of upper quadrant pain on the side, that especially in that 3rd trimester, we need them to come in quickly. If they have not had consistent prenatal care, they have questions, please feel free to definitely find a provider to come in. I know that I represent Kaiser Permanente, and we believe that we are a better choice in healthcare, but I understand that there's lots of folks out there that are doing their best to provide good healthcare to all patients, and specifically those who are most vulnerable, our African American patients.
Yeah, and Dr. Hines, sadly, there are stark disparities when we're talking about Black maternal health. So what needs to be done to close this gap?
I think the most important thing is what you said, access. That means that every Black mother needs to have access to the kind of health care in pregnancy that everybody does. And so we here at Kaiser Permanente do our best to make sure just because you are pregnant is enough to be able to be eligible for health care within our system to some extent. And so if you have health care early, that means that we find the problems, the diabetes, the high blood pressure, all of those things are important. And that's all through it. You get ahead of it, right? And so yes, there is the research, you didn't ask, but there is the research that talks about that even when you have education, resources, finance, support, that there still is an increased risk for complications in pregnancy, like higher risk for cesarean sections, higher risk for preeclampsia. So what can we do equitably? That means giving people what they need and understanding that even in a system that may not be as built for them, it can apply these principles equitably and make sure they get what they need.
All right. Well, we're so glad that you're here this morning raising awareness on this topic, and thank you so much for joining us.
Thank you so much for having me today.
Yes.
Great to be here.
It's a good conversation to have.
Absolutely.